Alicia Batram and I work at Canadian Mental Health Association in Tillsonburg.
I'm Kim Poole. I do IT for the Canadian Mental Health Association in Oxford County.
I'm Poonam and I work for Canadian Mental Health Lambton Kent branch.
My name is Shirley Fowler and I work with Canadian Mental Health Association, Lambton Kent branch.
My name is Lucy Foreman and I am a mental health court worker for Canadian Mental Health in Oxford County.
My name is Kelly Howell. I work at Canadian Mental Health Lambton Kent branch in Sarnia.
What OPSEU offered was they cover a lot of the mental health groups. A lot of the workplace, hospital and community were both joining with OPSEU. It's a bigger union. The dues were low. We knew from what we researched that there was good support for grievance issues and arbitration, legal supports, and specialty supports within the union.
I found union to be very supportive. They not only provide you guidance as far as the process is concerned, they also support you emotionally.
So I've been to a lot of the health and safety and steward-focused educational through OPSEU, and I've found them to all be very helpful. And it's not just about learning the law and learning the different strategies that we can use, but it's about networking with other professionals, really, especially when you get together with other professionals in mental health.
And the networking part's been great. I think it's been awesome to meet other local presidents and other members in this union that are active and have ideas for how to intervene with a difficult health and safety situation, or how you might advance with your labor management committee in moving things forward that aren't covered in your collective agreement.
When I started at this organization, I did not want to be a part of a union. After I worked there for 5 or 6 weeks, I realized there was a need, and I was very happy it was OPSEU. I had dealt with them in the past as a manager, but also as an employee. I was a member of the union as well, and OPSEU has done well by our organization.
I think we would be best serviced by a union that knows the issues that are happening in Ontario, and especially in our healthcare systems right now, who have already started, several campaigns around addressing some of the problems around that in our whole health system, and mental health being part of that.
There's understanding when we need to talk to somebody. They know what we're talking about. They know the language.
Some bigger parts of OPSEU, the outreach, the social justice fund, a mental health divisional committee where we could have a voice to try to impact change at the government level for what's needed in our service sector, but also through the social support system for our clients that we serve. The number of members that work in mental health in this union is huge. It's the second biggest in all of the broader public sector.
One of the positive things about OPSEU is that it is Ontario-based.
So when it comes to whether it's vacation, sick leave, health and safety issues, any types of those high priority categories, whatever you want to call them, that we all try and get some common language, so we're all in the same boat together.
Because don't you think that's an issue that's out there? The hospitals have been unionized for years. Some community mental health organizations have, but most haven't. And unfortunately, some are going with different unions. I think it's important that the four of us came together in this union, the 4 CMHAs that are here, and we keep in touch, and we do that through our local, but for the one up north, we still keep in touch through email and through messaging to see what's happening there, how can we support each other.
After we unionized, but before we had our first contract ratified, there was a lot of support for, coming up with mobilization and getting people involved and getting us even to have our meetings. We had the financial support there to enable us to have our meetings, to have people get childcare for their children so that they can attend these, because these are so critical and important when you're setting up the very first collective agreement for your agency.
I love my job. I love working with my clients. I love being able to advocate for them. I love to be able to provide them with a better quality of life in some small measure. We work with probably one of the most vulnerable population in our health system. And unfortunately, you know, the resources that should be diverted to them are not.
I think it's important that OPSEU represents and advocates for people that are in the margins in Ontario, because somebody has to fight for them. And you know, I've seen in the newsletters or in the news that you know, they're really advocating out there and trying to help. You know, it's not just about us.
It's been great to have a staff rep that's active, able to come down to a health and safety committee meeting and be firm when she needs to be firm, soften up when it needs to be softened, do some hard and challenging bargaining with the high-priced labor law lawyers that were hired for our units, and come out with a successful first collective agreement for each of our CMHAs.
She's very, very professional in her work, very empathetic, very supportive. And the best part that I found was that easily accessible anytime you give her a call, she's ever ready to talk to you.
I've learned from working with the CMHAs that the work they do is unique in terms of the clients that they deal with, but I'm particularly impressed by the passion that they have for their work and the passion that they have for working to ensure that the supports that their clients need are in place.
I would choose OPSEU again. How about you?